We've had a lot of conversation in the last week about the impact of K2 or synthetic marijuana on law enforcement. I can tell you to date we've had about 32 overdoses for the year of 2015, 25 of those in the last 10 days. All of the 25 in the recent 10 days have been associated with K2. And while that has had a significant impact on law enforcement, I can tell you that to some degree pales to some of the other service providers, both public and private in the city. And we've brought those individuals here today to talk about the impact synthetic marijuana and the overdoses has had on the city of Lincoln in our community. This isn't specific to any neighborhood. It's across the city. I think the average age on our overdoses is about 30 years of age. So it gives you an idea of, and it goes from 15 to the 50s on age ranges on those overdoses. We continue, as well as working the overdoses and enforcement action to try to impact the synthetic marijuana issues that we're having in the city of Lincoln. That includes some of those people have been cited for various offenses. We have seized a number of paraphernalia and synthetic marijuana packages from some of the stores that sell it. But as we go forward, I think the interest right now is the safety of the public. And that's why we brought together this group to help share the story with the community.
Good morning, Judy Halstead. I'm the health director for Lincoln and Lancaster County. We are looking at trying to, from a public health perspective, identify what some of the issues are that are going on in the community right now. Similar to what you would hear from us if there was a foodborne outbreak, or similar to what you would hear if we had a communicable disease in the community, we actually do surveillance for these kinds of efforts as well. And so when we hear from our community partners that we're seeing increased numbers, Chief Bonin is going to follow me, and he's going to talk a little bit about what Lincoln Fire and Rescue has seen, because they've seen a very high number, and our hospitals are here as well. Lincoln Public Schools is here, the Bridge, behavioral health is here, and so we're all here to tell you that we're all paying attention to this. We're all trying to get more information. Lincoln Lancaster County Health Department is actually going to be a repository from the hospitals and from the Bridge on information related to patients coming in and how sick are they when they come in. We're not getting any names, we're not getting any addresses of those patients, we're not getting personal health identified information, but we are getting information so we can try and track what's happening in the community. Obviously, we've seen very high numbers. Chief Jackson talked about what Lincoln Police Department has been seeing, but Lincoln Fire and Rescue has been seeing almost 3 times those numbers since last Friday. So we do believe that this is a public health serious issue right now. We obviously want to get the message out that K2 is not safe to smoke. We want our public to understand that, and that there are significant medical consequences that come from that. And so we want to make sure that that information is out there. Chief Bonin is going to talk a little bit about Lincoln Fire and Rescue's response.
Thank you, Judy. My name is Roger Bonin. I'm the Division Chief of Emergency Medical Services for Lincoln Fire and Rescue. Lincoln Fire and Rescue is a busy EMS agency, and we normally transport approximately 60 patients a day with 6 frontline medic units. Since last Friday, we've transported 76 patients that we believe have ingested smoke K2. That adds a lot of responsibility to our frontline providers. Quite a few of these patients are very sick. They never present with the same type of symptoms, so the paramedics don't really have an algorithm to follow in treatment of them. We've had to intubate or put a breathing tube down the throat of several of them, and others have presented very combative. Some of these combative patients have taken quite a few firefighters, EMTs, and police officers to physically restrain, and we've also had to chemically restrain them to get them in. One of my big fears is there'll be an injury to our EMS providers by fighting these people. And they present in such different ways. They may be totally obtunded, and 60 seconds later they're wide awake fighting. So we're pretty nervous about that. We've added some additional fields to our reporting system to try to capture this better. We've never had a used K2 field in our EMS reporting system before because it hasn't been that big of a problem.
We'll go through everybody and then I have questions. Dr. Bonin.
Hi, I'm Dr. Ed Malenik. I'm the Medical Director of Emergency Services at the Bryan Bryan Medical Center for both East and West. And we've been seeing things, as Chief Bonine described, that patients come in, and it's very unpredictable. It's a dangerous drug, and so they don't know how it will respond when they smoke it. We've seen patients come in confused, to being agitated, to the point where they're physically abusive and verbally abusive, where they need to be restrained to protect themselves and to protect the staff. In addition to that, we've had patients who come in completely unconscious, that have to have a breathing tube put in, put on a ventilator, get admitted to the intensive care unit. And we've even had one that had CPR performed because their heart had stopped. So very dangerous drug, and not one that should be taken lightly.
I'm Pam Randall, Director of the Emergency Department at St. Elizabeth, and I want to kind of reiterate what everyone is saying. We're saying the same symptoms of patients presenting. If they have underlying medical conditions, it just compounds the problem, where they're hallucinating, they're paranoid, and then 1 minute they're unconscious. So same symptoms and same issues that we're seeing at St. Elizabeth.
We do have representatives of Lincoln Public Schools here as well from their communications department. Just to save time and give you more time for questions, they're available to answer questions. Phil Tegler is here from the Bridge. Phil, do you want to come up and say a few words about the patients you're seeing that were not sent to the hospital? And then we'll open it up for questions.
I'm Phil Tegler. I'm the director of the Bridge Behavioral Health. Part of our role in the community is to serve as a diversion for clients that are admitted to our unit that might come from the hospital or be diverted from the hospital. And so we've seen a number as well. We've seen 7 in the last week that are coming to us to be housed in our facility under the influence of K2. These are clients that wouldn't have been seen at the hospital and were not discharged to the hospital. I think that's important. I think the other thing that's important here is that this response is a collaboration, and often in many communities it's tough to get numbers together, it's tough to get people together in an active sense to respond this quickly. So I think it's a good move on the part of Lincoln to address this critical issue. Thank you.
Pardon me, Jane?
Can we hear from somebody with the schools to find out about the problem, what they're seeing?
You bet. Which one of you would like to come up?
Zachary Bear, Communications for Lincoln Public Schools. Our role here is primarily community partnership, because when we have needs, we have reached out. Others have helped us out in many, many ways. And in this case, we have not seen a major problem in our schools, but we do have an interest because general public safety, plus some of these cases may have an instance, may indirectly involve students and families. So that's our general primary concern. Our biggest role here is just a community partnership, and we'll be preparing some messages to go out to families, most likely next week, and that's where we rely on Judy and the City County Health Department to help us out with that.
Yeah, I think the age question is a very good one. From a demographic perspective, we've looked at this at Bryan Medical Center, and we see 12 to 15 patients a day, and at times we've had as many as 9 patients in the department at one occasion where they're tying up 9 beds with us in the emergency department setting. So it is a burden on the care being provided to others with emergencies. But when we look at the age, we've looked at it and we've seen that about 11% are less than the age of 17. So as Chief Jackson mentioned, it's predominantly the 20-year-olds through 50s that we're seeing that are using this. And we're also seeing patients come back. So they'll have a bad experience, whether it's agitation, hallucination, or even one who's had a breathing tube put in. They go out and then they smoke this again, and then they end up coming back, unfortunately.
Other questions? Yes, Dan.
Can you talk to somebody from the police department?
You bet.
Police?
Brian.
I'm here.
There you are, I'm sorry. I guess, what have you been able to piece together as to, why now? Why are we having all of these particular overdoses?
Well, synthetic marijuana, and K2 is a brand name for synthetic marijuana, so we talk of synthetic marijuana. It is unregulated. It's sold as not for consumption, and it is really to the manufacturer on what chemicals they spray on this. And part of our focus and the public safety focus is there's something that's causing very bad reactions to a large group of community members in the city, and that's our concern. And we're trying to investigate into those. Many of those that are brought and present with those types of symptoms aren't able to talk to us and provide us the information we need. So a lot of the information we're getting is secondary through packaging, through receipts, through friends who bring in there. So it will take a period of time for us to go through that. But we are in a parallel process, also investigating the backgrounds of that. But our focus right now is the health and safety of our citizens.
And very recent chemical, this is a very new development as far as this chemical currently that's being sprayed on, that is it dangerous? I mean, because of the uptake that we're seeing right now?
The chemicals change regularly. Synthetic marijuana is regulated by the DEA. There are certain chemicals that are prohibited. The state of Nebraska has laws on the books on synthetic marijuana, and the chemicals change to avoid those statutes. Marijuana has a specific THC that's regulated because it's a plant material. This is a chemical, and it can change, the composition can change regularly just by what they mix in to their containers to spray.
Are you hearing about this in other communities?
It is a Midwest issue. We have not heard of an outbreak of this proportion of overdoses in any nearby communities. So it seems to be fairly specific to Lincoln.
So would that indicate that something's going on in Lincoln? This particular chemical?
We have a large group of service providers here trying to run that down and identify whether that's the issue or not.
So no specific age range or symptom range in a specific area in the city. Is there anything common between any of these cases?
Synthetic marijuana. I mean, to be honest with you.
But like a brand, I know when we talked about it before, there were 3 specific brands that were named off.
I think we have a wide range of brands that are being consumed, and we're also tracking those down when it's possible, that information.
Part of what we're trying to do as a community is to try to get numbers so that we know that we don't have duplicated numbers. And we're also trying to collectively, the hospital, for example, may have a family member who comes in and says, yes, this is what they used. Law enforcement may not have that same information. And so part of what the role of the health department is to try to gather some of that information to see, just like we would be looking for a bad product in food, we're trying to look at those same things too. We're doing that so that it can be fairly independent of the hospitals and law enforcement, but we're trying to get that information to see if we can find any patterns, to see if it's a particular product, if it's a particular brand that may be coming from one particular area, or if there's a group or a cluster of individuals that we can see any patterns. And so we'll be working in collaboration with the hospitals and with the bridge to get some of that data.
Assistant Chief Jackson, you mentioned that some folks were cited. How many?
Go to the mic.
I don't have a direct number of the number of citations we've issued. When this first presented to us, the number of overdoses, we went to the businesses who we believed were predominantly selling these materials and asked them to voluntarily remove this product from their shelves. I think some did comply, but I think they returned to the shelf shortly thereafter. That product has been removed because the Lincoln Police Department served some search warrants this last night and removed any remaining product on those stores. So,
How much and how many stores?
we served warrants on 2 separate stores and about 1,200 packets of synthetic marijuana as well as other paraphernalia.
Where were those stores at?
One was at 33rd and Y, and the other's at 2630 Orchard. And this goes in tandem with the health risks of the community and trying to do our part in minimizing that for the community.
There's a debate right now going on marijuana, legalization of marijuana, and some may say if you legalize marijuana, you would be able to regulate it and you wouldn't have these problems. What would you say to those people?
I'd say our focus today is the health of the citizens and the overdoses that are occurring, and that's a debate the legislature has, and our interest right now and our focus right now is the overdoses occurring based on the synthetic marijuana.
Do most of these patients have prior drug abuse or mental health problems that you notice like a pattern?
That may be a question for.
Yeah. You know, we have seen, generally the patients that come with this do have some type of other drug history accompanying it. And I think the important thing to recognize, so people don't think that this is really marijuana, as Chief Jackson said, it's a chemical that acts on the same receptors, but the response to it is different than smoking pot, for example. When you smoke pot, you don't get agitated to the point where you're assaulting people or stop breathing or have to have CPR done and get admitted to the intensive care unit. So that's the key. Even though it's called fake pot or synthetic marijuana, it's really a chemical that's acting on the receptors in the brain in a totally unpredictable and dangerous fashion.
Brian, how are you, and maybe Roger too, how are you teaching officers or firefighters to classify this? I know that sometimes they may respond and an officer may classify it as a narcotics, maybe another, it's a medical call, disturbance call. How is it being classified?
Well, the dispatch, the 911 dispatch center dispatches is on many different calls. They've came in as altered level of consciousness, unconscious, unresponsive, seizure type activity. And our providers sometimes know that it's K2 simply because their friend or the patient will say, I just smoked some K2. Other times we'll see the paraphernalia and we'll see a bag. And sometimes we don't know because they'll be there by themselves, but we suspect it. So there is no good answer for that, but those symptomology that they present with, being totally unresponsive 1 minute and waking up combative, that looks to our providers like K2. So that's why we've put this additional qualifier in our reporting system. And they have a choice, either known or suspected use.
Have you ever seen anything like this before?
No, I've worked in other places where we've had some heroin overdoses, but those people are unconscious, unresponsive, and this is totally different. We've never seen anything to this magnitude before.
Because of that, what's the fear of responding to a call where someone may be unconscious? I mean, do they know what could happen if this person was?
Well, I'm directing our providers to use physical restraints. We have wrist restraints, leg restraints on these unconscious, unresponsive patients, and we're asking them to take additional providers. Our normal response is with one paramedic and one EMT. The EMT drives the ambulance, the paramedic rides in the back. On these suspected cases, I'm suggesting that they take additional responders, which pulls responders away from the rest of the city.
That's a good point in the sense that on many of these calls to the police department now, where previously we may have only sent one officer, we're now sending two based on the unpredictable nature of the patients at times. While they could be lethargic, they could be unconscious, they could also be violent. And again, we found the whole gamut. So the resources of the police department are being stretched also by this current crisis.
Well, have you seen what other cities have done or other communities have done with this? I mean, have they had the same type of response? Are you patterning this after any other cities?
Well, if this is directed to law enforcement, we're certainly in contact across the state and across the Midwest, and they provide us educational materials on this drug as well as many others, as well as projects and actions others are taking to combat it. I think we're in line with that. If I had the answer of what's causing these overdoses, I would certainly provide it. But that's part of our process, not only for the police department, for everybody else here, to help identify and help bridge us over beyond that, and then we can work on looking backwards. But right now, we're looking at the safety of our community members.
I would also add that I think Lincoln is a unique community in the fact that we all work together pretty closely on a day-to-day basis. I don't know that other communities have the relationships that we do among our health providers and our emergency responders. Because of that, we've been able to call everybody together really very quickly and to be able to have an opportunity to try to get data, try to get numbers. Obviously, you've already heard different numbers in this room already. We've been obviously talking with Lincoln Police Department about their numbers, but recognizing that Lincoln Fire and Rescue is probably seeing 3 times what Lincoln Police Department was seeing, in part because they were getting the combative patients, while Lincoln Fire and Rescue was getting combative patients, but they were also getting unconscious patients and patients that thought might be having heart attacks and those kinds of things because of the effects of K2. So I think part of our community response is just to be able to get together as collaborators all in one room and talk about what are you seeing, what are you seeing, what are you seeing, and realizing that this problem is really very significant and that we all needed to come together to try and provide some communication to the public and work with our schools and our other health providers too. So, thanks.
Crisis type situation?
As you can say, Jane, none of us have seen these numbers before. All of us are very experienced. All of us in this, in our roles have been here for, most of us 25 years, 30 years, and we have not seen these numbers before. So I would categorize that as a very significant event for Lincoln.
I just wanted to make a comment with the patients who have smoked K2 or some similar product, that they're not all getting restrained. It's only when it's for their best interest and their safety. So, and it's really not every K2 patient that gets that. It's only when they're putting themselves at risk of hurting themselves or hurting staff. So just to make sure that you understand, we're not tying down every single K2 patient with restraints, so.
I just want to double check the number that you gave of transported patients, you said 76?
76 since
Friday.
last Friday. We had 12 yesterday. We were at 64 yesterday morning when we first met, so we've transported an additional 12.
So it's a little disheartening, even after the warnings and the alerts came out, that you guys are still getting more.
We have had repeat customers where we've transported them one day and then we transport them again a day or two later.
And as Chief Bonine can tell you too, it's not a time of day or day of week issue. It's literally every day, and we had 6 patients this week by 10 o'clock in the morning who came in with K2 overdoses. So it's not by day of the week, not by time of the day. It's literally every day, all day.
You don't know where these packets were manufactured out of, do you?
No.
No? I mean, they're not from California or Colorado or from someplace, foreign country.
Well, the bottom line is, we don't know. You can buy just the wrap and fill it yourself, if you choose. So, that's part of our investigation. That's part of what we're looking at. You can have them shipped to you, package and product, or you can have just the packages sent to you and you can fill your own. So that's the difficulty is answering that question.
Did you see any resistance from the 2 stores that you served warrants to take the rest of the paraphernalia and?
They were cooperative with law enforcement.
Which 2 stores are there?
One is Island Smoke and one is Aladdin's. Island Smoke's 33rd and Y, Aladdin's is the 2630 Orchard.
How many of these, if any, have led to, like, fatality?
I think Dr. Malinik would be better able to answer that, but as far as I know, none of them have resulted in a fatality for Lincoln Fire.
I'll speak to that.
In 2013, the Lancaster County Sheriff's Office did investigate the death of a young adult resulting directly from the use of synthetic cannabinoids. And so this problem has been ongoing for some time, and despite efforts by lawmakers and everybody in this room, we need to continue those efforts, but still the problem exists.
We did have one patient that had CPR done because their heart did stop, that then was admitted to the intensive care unit, and is still alive.
Any further questions? Great, thank you very much for being here today.